Hi, everyone. My name's Claire. I'll do a little bit of an introduction of myself here in a second. But today I know you all are together for your training this evening, and I've been brought in to speak on the health and wellness for athletes during this time and why understanding how a virus spreads will keep you free from illness. So I know you're entering this season of summer camps with some new rules implemented and some new precautions. And I just wanted to go over the kind of education piece behind getting sick and illness to help everyone have a better understanding of why precautions can be taken to really keep everyone healthy. So let's get started. So, who am I? As I said, my name's Claire. My name's Claire Doyle. I live in San Francisco, California. Right now, I'm a graduate student at SF State, and I'm completing a master's degree in the science in nursing degree. I have a focus in women's health and public health. So that is kind of where I get looped into these types of conversations. I've worked in healthcare in different capacities for 8 years now. Portion of that time as a certified phlebotomist. So someone who takes your blood, does lab procedures, amongst other procedures. I'm a big public health advocate and proponent. A lot of the work I do as a student and what I'll be looking to do in my career is through working with those who are uninsured, those in lower income brackets, minority groups, and public health in general, community health. How can people stay well as a population, health education. And right now I'm working with the SF Department of Public Health doing a lot of COVID volunteering. So setting up testing sites in different neighborhoods, screening patients, screening the community, educating community members. And I love to educate. I love to teach people and train people on different subjects. So I jumped at the chance to speak to you and your families to learn a little bit more about COVID-19 and the climate right now in health and all that good stuff. So to start off, as I said, I love to educate. So if we're going to talk about why we need to start implementing new rules or habits in a gym setting, I want to step back a little bit and start by just understanding bacteria and viruses and how they work and how they thrive here on Earth. So first of all, are bacteria and viruses the same? So they're both invisible to the naked eye. You can definitely see these under a microscope. Um, Bacteria, first off, there's both good and bad bacteria. So an example of good would be something like the probiotics, the germs that are in a yogurt. Or a bad example, something of a bacteria that would make you sick would be something like salmonella on some raw chicken. So you'll hear, don't use the same cutting boards for the chicken and the lettuce because of that, the bad bacteria that lives on there. Bacteria is its own living thing. So you can think of it almost as a very teeny tiny animal that goes about its business, looks for warm, cozy, moist places to live. It doesn't need a host to survive. So it doesn't need you or an animal to feed off of and live off of the cells of. If, again, it's its own little organism. Things that have a huge amount of bacteria on them would be something like our cell phones. Very few people actually wipe down their cell phones ever. And you touch them so often, you're out in public with them, they go in your pockets and out of purses. Toilet seats also are covered in bacteria. Our skin, if you touch your own arm, you're going to feel on there nothing, but it's actually swarming with good and bad bacteria that are keeping your immune system content. And I also added on there that antibiotics are what treat bacterial infections. So something like strep throat would be with antibiotics. You wouldn't take antibiotics for a viral infection. So let's switch over to the virus. The virus needs a host to survive. So that host is going to be you. They can't live independently. A virus kills the cells in you that it attaches to, and that's what makes you sick. It starts to feed off of your healthy cells and using them as a factory to create more of themselves, the evil virus piece. A virus that we're most often meeting would be something like the flu that comes around seasonally for most of us. So think about this. The flu comes around during a time that's optimal for it. It knows it likes to infect you when you're down, when your immune system's a little weaker during the winter months. Um, And it comes around when it knows it has a good chance of surviving. So that's what we're seeing right now with why this COVID-19 virus is so happy and so thriving, and why we know we can contract it so quickly is because it's realized this is a good opportunity for it to attach to people, find a happy home for itself, and it will survive right now on humans because we don't have a way to counter it as we do with, say, a flu vaccine, right, in the wintertime. Um, so that's why it's running rampant. So let's meet this COVID-19 virus. So COVID-19, the phrasing just comes from the breaking down of the words coronavirus disease and the year that it was established in our conversations, which was 2019. So that's where we call it COVID-19. As with all new viruses, we can think swine flu, SARS, mad cow disease. These happened over the last decade or so. They start by making animals sick first, and then they get smart and learn how to live on a human host rather than just an animal host. We are in such close contact with animals as people who eat meat, who process a lot of meat, who work in agricultural settings across the world. Animals are in homes, in and out of places people are eating a lot of the time. So we spend enough close contact with them, and the virus gets smart, learns how to live on us. They've tracked COVID back to a bat. Where it had been living on a bat. That bat came in contact with where I believe food was being sold and made. And I think that's how it got to a human. International travel and viruses' ability to make a happy home for itself in humans led to it spreading quickly. So again, it was able to find that glamorous house in a human body and all those cells that would attract it and host it. And it became rich very quick. There's our little rich COVID guy right down there. So why is coronavirus so good at its job? Again, corona means crown. You can see this is a very blown up photo of the coronavirus, and it has all those little spikes around the edges of it. It's crown shaped, and in this blown up picture, you can see that those crown prongs allow for it to embed into healthy cells really easily and make you sick. So it just is made to infect. It's a very well designed virus in that way. So when a virus comes around, this could be the flu or right now coronavirus, who easily gets sick? Because it's not just all of us, right? You yourselves are athletes, healthy folks who eat well, exercise, good blood pressures, I'm assuming, all the good things that make up a healthy body. So you aren't going to be the first to be preyed upon by a virus looking for a home. It's going to be elderly people like grandparents, people who live in close contact. I know a lot of nursing homes have been hit very hard because they've got a high population of older folks all living together in close quarters. So again, the more you expose yourself to other people, the more you're likely you'll get sick with any illness. People with asthma, coronavirus is something that really affects your lungs and creates a very terrible cough. So if you already are asthmatic, this can find a home in you and make it very difficult. And for people who are already fighting an illness. So if your immune system's already down, or you're already taking a lot of medications or trying to fight off something else, that's also an opportune time for that virus to come in and say, room for one more, because you already seem like a nice weak body that I can, start attacking. So if you're already sick or fighting an illness, that's also someone who is at high risk. However, I will say viruses are eager to thrive, and they aren't that picky. So we all do offer a happy home for it, even if we are a healthier person. So the question comes, how easily do germs and viruses pass between us? So I'm about to show you a few minutes of a really great video that demonstrates the passing through contact of germs and particularly viruses. Because as I said, viruses, they do need to live on a human, but you've probably heard about how surfaces can also be a place that they can sustain for up to a week. Usually I've heard 7 to 9 days without you. So they can simply wait and wait for maybe someone's hand to come and touch that desktop or what have you to then carry it on to join a body and cells. So with that, things like I know that will be implemented in the gym will be things like wiping surfaces, and what they're doing a lot at the grocery stores, wiping down where you're putting in your PIN number, things like that. it really comes from the fact that germs, viruses, bacteria, bad ones, they live on those hard surfaces and on our hands and pass between us with great ease. So let's take a look. We're going to watch just the first couple of minutes of this great video here.
I've always thought if we could somehow just see the germs around us, everyone would be a lot more careful and we'd get sick way less. Unfortunately, that's still not possible. So I did the next best thing by running a day-long experiment in this third grade classroom. I found this powder called Glow Germ, and just like real germs, when it's on your hands, you can't see it. But unlike real germs, if you turn a black light on, it becomes visible. But it transfers to things you've touched, so it provides a really good way to visualize exactly how germs spread. So before the kids arrived, as a control, I went around and noted any pre-existing spots in the room that fluoresced under the black light, and then it was go time. The kids, of course, had no idea what we were doing, and that the teacher had been secretly infected with the glowing powder. So she randomly shook the hands of 3 kids, but didn't touch any of the rest. And so with that, they just went about their normal day. Break, I did choose one random student, and he agreed to letting me put some of the powder on his hands too. And then 2 hours later at lunchtime, I checked the results. Remember, everything you see here started with just the teacher and 1 student having a little of that powder on their hands. And because my flashlight can only illuminate 1 spot at a time, I used Photoshop to better visualize our observations of where germs were left behind, including on the other kids. Uh-oh, we're pretty hot over here. Oh, right here. And they were actually pretty diligent about washing their hands. This was the desk of the kid that was infected. And what's crazy is that germs could live on a hard surface like this for up to 9 days. And so you can see how important it is to disinfect the things a sick person regularly touches. For example, this was the phone of the teacher in the experiment. Even if you wash your hands really often, if you immediately pull out your phone, a lot of those germs just go right back on your hands. Think about when the last time was that you cleaned your phone. My friend Joanne at the Wall Street Journal recently demonstrated you can clean your phone with an antibacterial wipe every day for at least a year, and it doesn't affect the oleophobic coating at all. And this hopefully gives you a better mental model of why it's really important to wash your hands or use hand sanitizer after being at places like this, or this, or this, or this. Cleaning commonly touched surfaces is important because even if a virus is spread through airborne transmission, those tiny droplets don't stay in the air for long. Then they land on surfaces waiting to be touched by our hands. Which raises an important point. The ultimate defense against catching a virus is just don't touch your face. Your eyes, nose, and mouth are like the single weak spot on the Death Star when it comes to viruses. That's the only way they can get in to infect you. But as you can see here, not touching your face is easier said than done.
Okay, awesome. Again, he continues with a lot of little experiments in this video. I'm going to share these slides with your teammates and your coaches so you can have them on hand. They'd have this video available if you think it'd be of value to show to friends or family, or if any of you are educators. It's an easy one to follow and learn from. Okay, so thinking on what we just saw with the passing of things, it's important to note, because I know he mentioned in the video, this is why it's so important to disinfect the surfaces where someone's been sick. So let's say someone's been in their bedroom for a few days with the flu, and then they come outside, you probably want to wipe down, the phone they've been touching in that room, or the lamp they keep turning on and off while they had the flu. But it's important that even if you aren't feeling sick, that with COVID right now, you can also be carrying the virus on you. So as I said, if you're a healthy athlete who is a phenomenal immune system and you're not going to get sick, you can still be a carrier or be what's called a vector for a virus, where it's on your shirt for a handful of days. You go sit in someone's car, on someone's couch, let's say of a grandparent's house, they go sit on their couch, their immune system's not as strong, and you've passed that virus that now can find a place to lay its roots and to infect that person who was easier to infect. So you might not feel sick, but you can still be carrying COVID-19 on your body. As he also showed in that video, the droplets from a sneeze, they can travel up to 6 feet or more even if it's a big sneeze that's not covered. And we're going to briefly go over the right way to sneeze here in a few minutes. But the virus is something that word droplets is key. It passes on those droplets that either are visual or are too small to see from your saliva or from a sneeze, or you going into your nose and then touching an elevator button or a handrail. So what you can do is you can take the precaution to be that middleman that's cut out. So here in the bottom image, you're contagious but with no symptoms yet. If you take that one extra step of staying 6 feet away from someone, or from washing your hands a few extra times while you're in a group setting, you pull that middleman out and you can stop that chain of continuing infection. So it's pretty cool. All right, so what's happening directly in Idaho? These were pulled just from the 8th, so a couple days back now. And this is from the Idaho coronavirus website, where they're keeping all this data as public information for everyone if you're curious. 3,189 cases as of now in the state. 20 new cases were confirmed simply on that day of June 8th, and 83 deaths overall from coronavirus right now in Idaho. I broke that down specifically to where you all are at in Ada County. And in Ada County, it's been 23 deaths. So when you look at that, it is a big portion of that state death total overall. So just something to think about. That's nearly a third of the whole state's mortalities from this virus. And I put here, your communities, we're tired of staying home, right? We're not having the freedom to go out and be about life as usual. And being tired of that is very understandable. We'll talk a little bit about this at the end, because I want this to be a conversation you can have as a group right now over your virtual meeting. But how can you set an example to stay healthy, at least in your immediate communities as a group of athletes, and also for your family? So it's understandable that, yeah, you look overall, you're like, man, I don't know anyone who's been sick. No one I know has been one of those 23 deaths in Ada County. And I'm really sick of having to stay home and not do my regular routines. And I think that that's a very valid argument, in that we aren't used to this life and it has hit us all very hard. But we still can, again, set an example, and you yourselves as young, thriving athletes being able to do that for your families and for your community and the broader scope of things. So again, why we care at camp. Here we have a nice photo of Stacy. This was when she was a teenager, just starting at her university level. Something I wanted to bring up was that we talked about folks who are high risk, one of those groups being those who have asthma. And Stacy herself actually does have asthma. So she is one of those high risk individuals right there at camp with you every day. And every day counts. When you are a teen athlete, you're working towards higher and higher goals. If you get sick and you miss days of valuable training, it can really set you back, because that's a day you didn't get to run through and work on your muscle, work on your height. Every day really counts, especially at this stage in your training as athletes. And it's not just COVID-19, right? If you had a cold and you were coughing a bunch and had a bunch of phlegm, you wouldn't want to be in the gym for that reason too. So just thinking of it in that way, sickness at all is something you want to keep out of the gym and keep from putting on others. But right now it's specifically just because of this rampant amount of COVID going across, the globe entirely. And I said, let's make camp worth it. This is something where, again, it just comes back to, you get sick, it's not going to be worth your time to have traveled there. You make others sick, it's not going to have been worth their time and their energies. So making camp worth it for the days that you do have there with Stacy and the team. And set an example. So I thought of, you can say this in the end, the best of the best being you guys training with gold medalist Stacy Dragila. That's why you're there. You're there to glean from Stacy's talents, right? Hosted athletes from around the nation during the summer of 2020, and no one got sick because they followed a couple simple precautions. I think being able to say that statement would be a big wow down the line, right? Because when people think back to the summer 2020, the year 2020 in the history books, it's not one of easiness, right? We've all right now hit a lot of walls in life, one of them being this pandemic. So if you can leave your year behind, having said this, I think that's something to be very proud of. All right, so then what is the plan? It's simple. And I know at the end of my presentation here, you're going to be speaking directly and going over the specific written protocols for the Stacy Dragila Vault camps. But here's just a couple of highlighted ones that really are universal right now, essentially anywhere you go, especially where I live in San Francisco. Using hand sanitizer, this would be before and after using your equipment. When sneezing, so I said we get to the sneeze, right? This is what's often called the vampire sneeze, or the way to cough like a vampire, like you're pulling your cape up over your face. You're not sneezing into your hand. You're always going to sneeze into your arm, or you could even lift up a shirt. If you have a shirt on that you could sneeze into, you don't want to sneeze into your hands, because then those become the vectors where you're touching everything. Stay separate from one another. So I think, to my understanding, you might have some cones kind of zoning things out in the gym. It's going to be 6 feet apart. Moving on, we've got number 4, wash your hands. This has probably been said to you 100 times by now, but a good rule of thumb, if you see a sink, take time to wash your hands for 20 seconds. That's singing the happy birthday song twice, or simply counting to 20. So wash your hands thoroughly. One of the first things you learn in nursing school, funny enough, is the proper way to wash hands, where when you're coming into it, you think, I think I've washed my hands my whole life, but no, there's actually an even better way to do it, especially if you're someone working in the clinical world. So that was something I had to learn. It really just involves making sure you don't forget about your nail beds and making sure you do your thumbs individually. Temperatures will be taken. So if you have a temperature over 100.4 degrees Fahrenheit, that's considered a fever. And fevers mean that your body is trying to fight something off. So if you have a fever, it's a great indication that you have some sort of infection. So that's going to be taken seriously. And ask yourself, do you feel sick? Cough, headache, fever, chills coming in when you feel sick puts the whole team at risk. And it can be any illness, like I said, even though right now COVID-19 is what we're talking about. If you're feeling sick in any way with anything, is something you want to keep away from others. Okay, but I know what you're thinking. This is all so annoying, right? But I think that that's something that the coaches and I myself, as I speak to so many people here locally, get, right? We don't want to have to change our routines. We thought this wasn't going to last this long. Your camp is memorable for more reasons than just vaulting. You know, you want to connect, you're high-fiving as athletes, you want to hug each other, you are seeing old friends, you're meeting new ones. And being the one to follow these rules in any setting can make you feel like the odd one out. If you're at the office, at the workplace, if you're at the gym, if you're a student in class, anywhere, and you see a classmate or a gym mate not go for the hand sanitizer when they leave a station, and you're the one who says, excuse me, I think you were supposed to use some hand sanitizer, you're obviously labeling yourself like the one who loves rules and the teacher's pet, or whatever you want to say, right? And so that can feel odd, and it really comes down to, I think, in at least the setting as athletes and spending time together this summer, not so much as rolling into that labeling of, you know, teacher's pet or the one who's over it and thinks it's not that big a deal, but really being a leader. I want just thinking, you could ask yourself, well, I remember this is a time I showed leadership, or as a time when I could have done better. I know Stacy and Stephen and Steve Thomas, they are putting in a good amount of effort and time to make these pieces part of your daily lives at camp and at training, because they are showing you great leadership. And you can give that right back to them by, if someone asks you to do something or says, hey, we need that temperature before you enter the gym today, it's not a situation where there's a huff and a puff, but a situation where it's like, that's right, I remember. It's because you took the time to write those protocols, and you took the time to make sure we can all stay healthy for the couple of weeks that we're here together and have a good time and not get sick and have to worry more about it, right? The golden thing is, you all leave, you're not sick, wonderful. Who knows if any of you carried the virus, or you might say, well, I don't even wipe my hands as often as they wanted me to, and I didn't get sick, and I proved the point. Do as best as you can. These protocols are in place to help everyone. Everyone leaves, no one gets sick. That's the goal. So do ask yourself that, and look at it as a way to act as a leader and a role model for you and future students and future people who are going to train with Stacy. And it's easy in the end. So I just would ask that of you. And I know a lot of people who are really kind of over it right now, right? Um, but we can all do that small thing. So again, remember, all things must pass. This is temporary. So it's going to put a wrench in your lives right now at camp and also probably home life and social life. But it's temporary. It's something that we are going to look back on sooner than later, and it won't be our everyday routine. The gym rules that are being implemented are easy to follow. You know, it's a matter of washing hands, wiping things, staying separate, and getting a little click of a temperature. So simple things to follow, and you and your families have paid for you to be at camp. So again, let's make the most of it. Let's use our time wisely and make sure we don't make a small mistake that could lead to someone getting sick. It's also a matter of respecting Stacy. Again, I said she does have asthma. She's high risk. Respecting the rules of camp and showing that leadership in yourselves as young athletes. And in the bottom, just trying to stay healthy. That's all we can try and do, right? Um, so I've now had a chance to talk at you guys. Of course, I'm not there in person. I thank you for listening, but here's where I would like to open it up to everyone who is on in asking, what do you think? So I know that your families and you are here, and a lot of it is talking at you and telling you, here's why, and you better just do it type of energy. So I think it's valuable to hear about those frustrations, right? I know plenty of people who've lost their job. Getting on unemployment is so difficult, and a lot of red tape involved. So that can be a huge argument, right? If I can't go look for work and you're closing all these businesses down, how do I feed my family, right? Like, I'm going to show you this next slide here. It just has some photos that have been going around over the last months. There's the arguments of, let me go back to work. I'm tired of doing this. I will not comply. I don't want to feel, policed in my own city when I'm a good tax paying citizen. The Starbucks being temporarily closed. This isn't what I want, right? This isn't how I want my world to be. But then you have the healthcare workers protesting that you not wearing a mask is a sign that I'm here to save your life whenever you come into my hospital. But yeah, now you're putting my life at risk not wearing a mask. So I think these conversations are ones that need to be had, especially when there's multiple sides to things. And when, as a camp, you are being asked to comply with some rules that maybe your family has different opinions about, or you yourself just have more questions about, or maybe you're totally neutral and just, yeah, let me know what I need to do. I'm not sure if I know anyone who's ever going to get sick from this. I just want to open that up to you all. And if you can take the next few minutes live together, I'm going to go ahead and end my lecture here. And again, thank you for listening. And I'm available if you do have follow-up questions. But I would ask that maybe Steve or Stacy can take on just opening this up to the group and seeing if what more questions evolve or concerns people have right now. So thank you so much, you guys. And again, my name is Claire, and I hope you all have an amazing summer. Take care.